Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great video for those of you with herniated, degenerative, and bulging discs in the lower back. We're going to be talking about why traditional ab crunches and sit-ups may be very dangerous for your discs and a great alternative. Hope you enjoy. So remember that lower back discs are typically going to be aggravated with flexion. Flexion meaning bending forward at the spine or losing the curve in our lower back. When you do a sit-up or a crunch, you'll feel the arch in your lower back flatten. When that flattens, that's flexion. That's bending forward on the spine. Flexion, axial compression, meaning compression from head to toe, and rotation or twisting are the three most dangerous movements on spinal discs, especially in the lower back. Leading experts in sports medicine and rehab when it concerns lower back disc problems, both herniations, degeneration, and bulges, all part of the same cycle, just different points in it, always recommend that we avoid flexion, especially heavy-weighted flexion. Many people do not realize that full sit-ups and even crunches, when you're coming up a bit with crunches, put a flexion force because that curve in your lower back flattens out. If you put your hand under that arch in the back, you're going to notice that flattens when you come up. If you're doing crunches correctly and you want to try to use both ends of your abs, not only your rib cage moving up, but your pelvis tilting, when you perform them, typically you're going to tilt your tailbone under a little bit so the abs pull from the pubic bone and the ribs to give yourself a nice full abdominal workout on those rectus abdominis and oblique muscles. We want to try to avoid, especially if we have an acute disc problem where we're having pain recurring after ab workouts, we don't know why our abs after ab workouts, our back is bothering us a day or two later, we may want to look into the fact that as we're doing fuller sit-ups all the way up, or even leg raises as we do leg raises, and crunches, we're using too much flexion, meaning that although the spine is not bending fully like when we're bending from head to toe, we're still getting enough flexion to irritate those discs. So a great alternative is to straighten your legs, because when you straighten your legs, what you realize is you'll feel the arch in your lower back increases. If I have my legs bent and feet flat on the bench, there'll be a decrease in that arch in my lower back. And when I straighten my legs, especially if I can allow my knees to just go a little bit beyond the edge of the bench, that creates a little bit of false hip extension, meaning my legs are dropping slightly backwards. And my whole pelvis is going to tilt slightly forwards, pubic bone going down, the opposite direction of a crunch. This puts me into a little bit more of extension, which is a little bit more of an arch in the back, meaning that I'm further away. I'm in a deficit from the range of motion that's going to cause flexion. It's the opposite of bending forward. It's literally bending backwards. So I don't want to go as far with my legs down on the ground that causes back pain, because if I have a disc herniation or bulge going backwards, too much extension could pinch me, but I want to go to a comfortable amount. From this position, if I perform a curl up, which is a very short modified motion where I'm just coming up a little bit, you'll notice in your lower back the arch is decreasing a little bit but still maintains. It's not flattening out all the way. So this is a great way where I can even use that posterior pelvic tilt with my curl up, where I tilt my tailbone under, to train the abs where I'm at a deficit range of motion and I'm not in flexion, but I'm actually moving from extension more towards neutral and avoiding flexion. And you'll feel your abs working just as great. It's just that they're working over a different range of motion. I encourage you, if you do have abdominal training problems with your discs and you notice lower back pain irritated, either with bulges, herniations, or degeneration, to plug this one into your training. You can even do rotational curl-ups where you're coming up and rotating to one side. Just make sure that you're rotating towards the natural side that, of course, you're either weaker to. You find that through an analysis. If you don't know what your body analysis is with your mechanics and how it's affecting low back pain, go to the painfreeandfit.com website. We have a great body analysis there you can check out. Or you've determined you have less range of motion going into that way of rotation. So if you're using this with rotational crunches to emphasize more of the obliques, you always want to do your rotation to your stronger side first and your weaker side last. So I do all my curl-ups to one side, and then finish off with my weaker side or tighter side, so I'm leaving the body in a state of correction biomechanically to produce less stress on my spinal discs. If you like this video on ab training and curl-ups, replacing sit-ups and traditional crunches. Feel free to subscribe to our channel. We've got a lot of great videos out there to help you, not only with ab training, but all kinds of rehab exercises and fitness exercises, working out without aggravating your back. Questions or comments, write in. I'll do my best to answer them as always. And remember, if you're looking for a great program to figure out how do I train around and how do I get myself with a targeted routine to help rehab my lower back disc issues, check out our degenerative disc program, our fast track program for degenerative disc disease, available at painfreeandfit.com. It's appropriate not only for degenerative discs, but also for bulging discs and herniated discs, because as I said, all three of those things are the same problem, just different points in time and how intense it is in terms of the degenerative and breakdown process. I hope you have enjoyed this video on ab training and degenerative herniated and bulging discs with sit-ups, crunches, and the alternative method, curl-ups.